The neurological exam focused on stroke. For the sake of time, I'm not going to read through this slide, but I will attach my PowerPoint so you can read through it on your own. All right, to start my assessment, I'm going to ask my patient orientation questions. Can you tell me where we are?
Our apartment.
And how old are you?
31.
And what year is it?
2023.
Perfect. And then to assess memory, I'm going to have you remember these 3 words later on. Can you repeat after me? Cat, ball, tree.
Cat, ball, tree.
Perfect. And then to assess for cranial nerve number 1, I'm going to have you identify this smell.
Lemon.
Perfect. And then for cranial nerve 2, I'm going to look into your eyes with my ophthalmoscope. Look at the fundus. I'm then going to have you cover one of your eyes. And then while looking straight, tell me how many fingers I'm holding up.
1. 4.
Good. Well, good. I would do the same with the other eye. I would also test for visual acuity at this time. And then to assess for cranial nerves 2 and 3, I would darken the room and look for pupillary response to light. I want it to be brisk. And then for cranial nerves 3, 4, and 6, I'm going to have you follow my finger with just your eyes, not your head. Good. And then for cranial nerve 5, I'm going to have you clench your jaw. I'm going to feel for that clenched muscle. Good. For cranial nerve 7, I'm going to have you smile for me, showing your teeth. Good. Puff out your cheeks and then raise your eyebrows and clench your eyes shut. Perfect. All nice and symmetric. For cranial nerve 12, I'm going to have you stick out your tongue and move it side to side for me. Good. For cranial nerves 10, I'm going to have you say ah. I'm looking for the uvula is midline. I'm looking for movement of his palate. And then I'm also assessing for vocal quality. For cranial nerve 11, the spinal nerves, I'm going to have you shrug your shoulders against my hand. Good. And move your head side to side against my hand. Good. And then for cranial nerve 8, I'm going to have you close your eyes and tell me where you hear noise.
Right here, left here. Both.
Good. And that completes the cranial nerve assessment. I'm going to ask you those memory words at this point. Can you repeat those for me?
Cat, ball, tree.
Good. And then we can assess for coordination and fine motor with rapid movement. We can also assess coordination with the finger nose assessment. So I'm going to have you take one finger at a time, touch my finger, and touch your nose. Good. And I would do the same with the other hand. Balance is assessed with the Romberg's test. And then gait, you can assess posture and sequence, as well as rhythm as they walk in the door. Sensory can be tested by using both soft and dull to hard or to sharp tools. Can you tell me where I'm touching you with your eyes closed?
Left cheek.
Good.
Right hand.
Good. And you would want to do that throughout the body. And then for corticosensory response, you can do vibration testing. You can do proprioception testing with the fingers and the toes. And then stereognosis, I'm going to have you close your eyes. I'm going to hand you an object and I want you to tell me what it is.
Done.
Good. And I would do that with a different object in the other hand. Next, graphesthesia. I'm going to have you close your eyes and tell me what number I'm drawing on your palm.
2.
Good. And that would be done again with the other hand as well. The last assessment is deep tendon reflexes. And then you can also add on Babinski reflexes, which we would want to be negative at this stage, at his age, and then also assess for clonus at that time. Subjective inquiries for stroke include the B-FAST mnemonic, which means balance loss and dizziness, eyesight changes, facial drooping, arm weakness and numbness, speech difficulties, terrible headache, and time is to call 911 immediately. And the important thing to note here is stroke is an emergency. The old carts for stroke would be sudden onset. The location would be the neurological function. Duration would mean that a stroke will continue to negatively affect the neurological function until it is treated. Characteristics of a stroke include the B-FAST mnemonic we talked about earlier. Aggravating factors include time. Relieving factors are essentially just treatment. Radiation, some strokes may cause other symptoms dysfunction, such as incontinence, nausea, vomiting, respiratory difficulty, confusion, and then cardiovascular symptoms as well. Timing, a stroke is an emergency. Symptoms will continue to worsen the longer the patient goes without treatment.
For the purpose of this exam, I took the example of a right MCA ischemic stroke.
Before I begin my exam, as a disclaimer, any sign of stroke, first sign of stroke, a patient should be immediately transferred to the hospital for proper treatment and care, given stroke is a medical emergency. The things you may notice in a stroke is, in terms of orientation questions, they may or may not be able to answer you, given they could have memory problems, they could have expressive or receptive aphasia, as well as dysarthria. In terms of cranial nerves, they could have a visual field cut. In terms of a right MCA stroke, given our example, they will have that cut on the left side. So I'm gonna have the patient cover their right eye and I'm gonna ask them to identify the numbers I'm holding up.
4. I can't tell.
They will also have potential pupillary changes. They could be normal, they could be sluggish, and in severe cases, they also could be fixed. Cranial nerves 3, 4, and 6 could also have deficits in terms of visual neglect. Patient may not be able to cross the midline towards that contralateral side in terms of an MCA stroke on that right side. So I'm gonna have the patient just follow my finger with their eyes. Again, that visual neglect on the contralateral side. In terms of cranial nerve 7, when the patient smiles, you might notice that contralateral facial droop on this left side. They may also notice weakness when they puff out their cheeks on that contralateral side of the stroke. In terms of coordination, when you ask them to do the pronator test, so I'm going to have you hold your arms up with your palms up and then count from 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. You may notice a drift on that contralateral side to the stroke when it comes to a right MCA stroke. They may also have ataxic symptoms, which you may see in their gait, but also in the finger to nose test. I'm going to have you take your left arm, touch my finger and touch your nose. And they won't be able to do that if they have ataxic symptoms. In some cases, a stroke may cause hemiparesis or hemiplegia, which either will be a fully paralyzed unilateral side or a weakness in one side of their body. Their balance may be affected, and then their sensory reception also may be affected. So if I ask the patient to tell me where I'm touching.
Right arm. Right wrist.
So again, a sensory neglect on that contralateral side to the stroke, which in our example would be a right MCA stroke.
Risk factors for stroke include hypertension, obesity, a sedentary lifestyle, smoking, stress, hyperlipidemia, previous TIA, obstructive sleep apnea, heart disease, use of oral contraceptives, sickle cell disease, congenital CV abnormalities, and then a family history of diabetes, CV disease, hypertension, and hyperlipidemia. Differential diagnoses to look out for include Bell's palsy, brain neoplasms, migraine headaches, seizures, systemic infections, hyponatremia or hypoglycemia, or conversion disorder. And these are my references.